Once more, welcome all the online students. We get from Kurnool, first is pituitary adenoma, pituitary, second is ectopic. You also agree with that? Yes, ACDH pituitary tumor is diagnosed not suppressible with low dose but with high dose, and neither of them in ectopic ACDH is what need to be remembered. What is the ID reaction? Fungus free eruption, identity reaction it's called. Now coming to postoperative wound infection. So lot of patients in government hospital postoperatively will not have antibiotic money to pay after not even for pre or post also. But if a doctor gets his wife operated, what he will do? 10 days before only he will start antibiotics. After that another 10 days, and finally the wife gets pseudomembranous colitis with diarrhea and dehydration and dies. So that's how she will go to postmortem. So doctor, how many days antibiotics according to Shastra are indicated? Postoperatively. Perioperative antibiotics they are called, within 24 hours period surrounding operation, before and after, but on the operation day. But we don't follow the rule, we give for 1 week, 10 days, etc. Now doctor, UTI, prior to surgery only you need to basically repair, otherwise postoperative wound infections will be more. ट्रांसफ्यूशन के साथ रिंगर लैक्टेट भी गए तो क्या होगा? ट्रांसफ्यूशन के साथ अगर 5% डेक्स्ट्रोस वाटर सॉल्यूशन आल्सो इज गोइंग, व्हाट क्या होगा? If it is 5% dextrose and water, it will lead to hemolysis. If it is calcium containing solution or ringer lactate, दोनों चल रहे हैं तो same transfusion के साथ it will lead to thrombus, is what need to be remembered. If there is an accidental aspiration of gastric acid, then you need to basically do a intubation and suctioning is required. In acute hemorrhage, there is a lactic acidosis which will stimulate respiratory rate. So tachypnea will be there as a consequence of metabolic acidosis in hypovolemic shock. What are the indications in pseudomembranous colitis to do surgery? If there is an intractable pseudomembranous colitis not responding to Vancomycin, and if there is a toxic megacolon or a colonic perforation, indication for surgery is what need to be remembered. Now coming to the wound healing, monocytes are very important for the wound healing. Why? Because monocytes produce PDGF, TNF, fibroblast growth factor. All of them are produced basically by monocytes, hence they are very important for the healing of the wound. Then pulmonary embolism can lead to VQ mismatch. If you give lactated ringer solution in a hypovolemic shock, what is the advantage of it? It will alleviate the interstitial fluid compartment deficit and improve the hemodynamics, which is an advantage if you give ringer lactate. Some studies said ringer lactate can lead to lactic acidosis, which is bad for a hypovolemic shock patient, but that effect is very minimal, really it does not affect. Hence if you have to choose a fluid, ringer lactate is still good because it will improve even interstitial fluid deficit is what need to be remembered. Coming to breast cancer, the women who gave the first birth after 30 years have approximately twice the risk than those who have given the birth before the age of 18 is true. Between lower and higher socioeconomic status, who has a greater risk of breast cancer, doctor? Higher socioeconomic, lower socioeconomic status have got cervical cancer risk, as all of you know very well. Then what is the risk if there is a family history? Auntie ko hai, sister ko hai, sab ko hai, twice, not 4 times. Okay doc, give me an answer. Self-limited hypothyroidism it is. Which thyroiditis? Flu-like illness के बाद आएगा. Granulomatous inflammation will be there. High ESR will be there. Very tender thyroid will be there. Which thyroiditis? D. Quervain? Very good. That is the answer we get even from our online students, which is called subacute thyroiditis. How do you qualify riddle? Fibrous tissue accumulate hoga. Hard, painless goiter it will be in the case of the Riedl's thyroiditis. What is the difference between kidney transplant and heart transplant? HLA matching is an issue only for kidney, not for heart. Heart में दिल का साइज इज इंपॉर्टेंट. जरा बड़ा दिल करो साहब बोलते ना भाई, क्योंकि your heart is very small, if you require a transplant my heart doesn't fit. So size is important criteria when it comes to heart. And another thing is A vivo group is important for both kidney heart. B positive guy can't give heart to A positive guy unless they marry. For real transplant it can't happen. Now interleukin 2 recombinant form is currently used for metastatic melanoma. Last time we had which interleukins recombinant forms, what are their names, where are they used? That list you need to remember. Now doctor, it is the indirect inguinal hernia which passes to the inguinal canal. Then if you are suspecting biliary obstruction, extrahepatic, then endoscopic ultrasound is the modern buzzword which can be able to detect it very clearly. And when do you want to do CT? If there is a distal common bile duct obstruction, then CT scan is recommended, because commonly it is the head of the pancreas tumor which lead to the development of a distal bile duct obstruction is what need to be remembered. Where do you want to do laparoscopic cholecystectomy? Is it unsafe compared to that of the regular conventional cholecystectomy is the question. Cirrhosis, prior abdominal surgery, suspected bladder cancer, gallbladder cancer, they are all contraindications for laparoscopic cholecystectomy. Morbid obesity is not a contraindication, you can very much safely use it. Craniopharyngiomas, they are fundamentally cystic tumors with calcification originating from Rackey's pouch is what need to be remembered. They can compress and can lead to optic chiasmal defects just like pituitary adenomas. Now doctor, diffusely enlarged breast which is erythematous with supraclavicular lymph node involvement, which stage you call it as? It's an example of an inflammatory breast cancer is what need to be remembered. Now coming to the incidence of breast cancer, every passing age we are at the risk of cancer. So there is a reason. A 60-year-old woman has less breast cancer risk than 80-year-old women is what need to be fundamentally remembered. Coming to the nipple discharge, if there is an intermittent milky discharge, it can very much be physiological is what need to be remembered. Now doctor, bifurcation of aorta, Lerith syndrome, what do you have? You have the buttock claudication, impotence, they are the classical features of the aortic claudication. Okay doctor, shoot me an answer. Last question, D. Quervain, lot of people answered it correctly except Raj from Hyderabad who said riddle, which is not true. Okay. Hypocalcemia, hyperphosphatemia, increased alkaline phosphatase with increased PDH. You find this combination in primary, secondary or tertiary hyperparathyroidism. I mean hypoparathyroidism. Alkaline phosphatase is elevated, no? Hyperparathyroidism. Which form of hyperparathyroidism you have this combination? Yes? Tertiary? Primary? Secondary, very good, very good. That's the correct answer. Most of the people said secondary and disappointed me. Nobody said primary. Everyone is right. Are kya ho raha hai? So doctor, calcium levels are important. Hypercalcemia hai to you will recognize it as primary hyperparathyroidism. Hypocalcemia makes you recognize it as secondary. Why will secondary hyperparathyroidism occur in renal failure? Renal failure में hypocalcemia है. Parathyroid adenoma के वजह से primary hyperparathyroidism होगा, which lead to hypercalcemia with hypophosphatemia. Why there will be hyperphosphatemia in secondary? Once more, renal failure is underlying cause of secondary. Renal failure में hyperphosphatemia naturally होगा. So summarize, hypercalcemia, hyperphosphatemia is secondary, hypercalcemia, hypophosphatemia is primary, is what you are not going to forget. DVT, yes, that is a different risk for pulmonary embolism. Hasselbalch triangles say direct inguinal hernia will be protruding. In Ewing sarcoma, whatever be the histological subtype, based on the staging we need to treat same way, everything. Potts disease, tuberculosis, is it common in dorsal lumbar or thoracic? Dorsal lumbar? Huh? Then night crying is typically found in tuberculous arthritis. Why? Child will be crying suddenly in the night with tubercular arthritis. Tubercular arthritis can involve knee or hip joint, doctor. Agree? Arthritis means what? Inflamed bones in the joint. Morning time when the child is awake, he will have the muscle spasm, which prevents one bone touching other. Night time hote hi, when you sleep, muscles relax, both the inflamed bones will touch and baby will get up and cry. Hence night cries, very classical of the tuberculous arthritis is what need to be basically remembered. Ayer's tube, 2 to 4 liters, too much. Who will remember? Only those who are attempting entrance for past 5 years will precisely remember. So, antidote for diazepam, flumazenil, everyone knows.